Let's talk a little bit about the advantages of mechanical traction. The force and the time are well controlled, so we can readily grade and replicate the treatment, which is really nice for us to be consistent. Once it's applied, as a clinician, you do not to be there the whole time with your patient throughout the treatment. So you give them a bell and you give them their what we call the kill switch or the safety switch so that they can turn it off automatically. If they have any symptoms, they ring the bell. I'm going to come see you. Just like any other thing when we're doing it for the first time or we're raising the parameters differently, always set a timer for 5 minutes to come back and check on them too, just to make sure that they're doing okay and they don't have any new symptoms that you want to be concerned about. And you're always going to advise them on the things that are not normal that you don't want them to feel as to when they would stop that traction and ring the bell for you. The electrical units may be static or intermittent, so you have that choice between the two. The static weighted devices are inexpensive and convenient for home use by our patients. So there's a lot of home traction units that are very effective for patients that are either covered by their insurance or fairly affordable for them to buy if they're a cash pay patient. The disadvantages of mechanical traction, they are expensive. They take up space. They're time consuming to set up unless you use them a lot, and then you get more efficient at that. You have lack of patient control or participation. They're pretty passive in that. Restriction by the belts or the halter, poorly tolerated by some patients, but that's where you pick and choose the patients that you want to use this with. Mobilizes broad regions of the spine rather than individual spinal segments, so potentially inducing hypermobility in normal or hypermobile joints. So you just, again, want to be intentional on the patient population. So you have that patient who's just got general stiffness throughout their spine. This is perfect for them, but for that person who has more hypermobility somewhere, you might not want to use this, okay? You aren't able to isolate out the joints as well. So this is just a sample of a setup. So here we have this person in 90-90. So think about, okay, what section of the lumbar spine do we think this is isolating out? So we're going to say this is probably going to isolate out more that lower thoracic, upper L1, 2, 3 lumbar spine area with this patient. You can see they have the pelvic halter right above the iliac crest. You can see the pole is even on both sides here. That's really important when you're setting up your patient. It'll be one thing that you guys have to check is make sure there's an even pole on both sides for that patient, so you get that symmetrical pole. Sometimes we have a spreader bar here if we're wanting a different type of pole with that patient. Then the upper thoracic one, we want to make sure that it's nice and snug, and that's just what's stabilizing that patient so you can get that pole there. And again, they have the locking mechanism here to open that up. We have them right where you want that separation at. And basically what that does is allow you not to have so much force because you're eliminating the friction of the table in order to get that distraction from the patient. Okay. Here's a prone setup. And you guys will do this as well. So here he's setting him up here. He hasn't put the thoracic one on him yet. And again, you're going to want to make sure that pull's nice and even, that his feet are off and comfortable. And then with this patient, think about what level, why would you be wanting to do this? So this is that patient that extension centralizes their pain, makes them feel better. And it's more that lower lumbar area, generally speaking. So more from about L3 down to L5 is going to target that area a little bit more specifically. Okay, and you could also put them supine with their legs straight. This is just talking about the split table. We talked about it eliminates the friction, so you don't need as much force to get that distraction and be effective. These are the different types of traction belts. We have both in the lab, and you'll find that you like one over the other. It just really varies. So this one really does help you be, I think, a little bit more accurate in where you're pulling. This is showing the spreader bar. You also can do it without the spreader bar. This one is easier to apply, but you also, it's not as specific on certain areas of the spine. It gives you a little bit of limitation on that. So you can try them both out and see which one you like better. This is the cervical spine, so I think we'll stop there for this and then we'll talk about this separately.